What I don't see anyone talking about is that an inflamed joint is a joint that's working too much, and it needs something very simple. Back pain, whether when you stretch or twist, has nothing to do with a herniated disc, and even less with age. In this video, I'm going to show you how to test the joints in your spine and teach you 2 exercises that can relieve this right away. And best of all, you'll see that you don't need to be young, thin, or very flexible to do these exercises and have a spine with good movement. Did I really hear what I think I heard? This pain shows up when we try to close a joint that's inflamed or injured, and the joints in the spine are located at the back. That's why it bothers you when you stretch or try to twist your spine. And a lot of people confuse this with a herniated disc, which has nothing to do with it. The joint test is super easy. You're going to lean away and it hurts. If the pain is on the right side, you're going to lean a little to the left. And in this position, you're going to stretch and twist. If the pain decreased a lot or didn't hurt at all, the problem isn't muscle, isn't disc, and isn't ligament. The problem is some sensitive joint on this side, inflamed, injured. And here I see many health professionals, doctors, physical therapists saying you just need to take anti-inflammatories or just rest. The problem is that the pain always comes back. What I don't see anyone talking about is that an inflamed joint is a joint that's working too much, and it needs something very simple. It needs the other joints to move so that it doesn't work more than necessary. Until we remove the restrictions, this joint will always be overloaded, get hurt, and become inflamed again. Jesus. And let's start by removing the blockages from those who are watching above the problem, from those who are above the facet, the inflamed joint. You're going to make a very soft roll with your towel and place this towel roll above the spot where it hurts. If you feel the pain here, you're going to place this roll above it. Lie down slowly with your legs bent and your feet flat, preferably without your sneakers so you don't get the couch dirty. Legs bent, feet supported. Let's start by staying in this position for 30 seconds. Breathing slowly. The idea here is as if we're going to stretch the entire spine. After 30 seconds, the next step is to start raising your arms. Remember, the idea is stretching. So we're going to start stretching the upper part. Look, raise your arms slowly as far as it's comfortable. If you can stretch your arms all the way, great. If not, stay in a position that's comfortable for you. Hold this position for another 30 seconds. Breathe slowly, trying to relax your body on top of the towel. Gradually, this position will become more comfortable. We're removing the blockages from the joints that are above the inflamed joint. After 30 seconds, you're going to stretch the lower part. Slowly stretch your legs as far as you can, as far as is comfortable for you. Again, you don't need to stretch your legs all the way. Go as far as is easy, comfortable, as far as feels pleasant. This is very relaxing. Stay in this position for another 30 seconds. Pay attention. The rule here is not to force it. If you force it, the muscles won't relax and the blockage will remain. Breathing. When you finish the exercise, bend your legs, bend your arms, lie on your side, and sit up with the help of your arms. At the end, move just a little to feel your spine moving more freely.
I'm alive.
Now we're going to release the restrictions below the problem area. Mainly the sacrum, the pelvis, and the hips. Again, let's use the towel roll. This time, you're going to place the roll under the spot where it hurts. Lie down with your legs straight and apart. Here, you'll stay for 30 seconds breathing slowly while your spine gets used to the position. After that, you'll start swinging your legs in a very loose, rhythmic, and relaxed way. Here, we're taking this release beyond the joints. We're bringing this release to the muscles and ligaments of the lumbar spine. 30 more seconds. After that, you're going to bend your legs and cross them. Let your foot drop like you're trying to touch the sole of your foot to the mattress. Go only as far as feels good and comfortable for you. No rush. In this part of the exercise, we're working on unlocking the area around the sciatic nerve, here where it passes behind the hip. You're going to do this slowly, no rush. 10 times on each side. You'll do this routine once or twice a day, and soon you'll see that the pain will get better. But that feeling of being hurt will also improve, that fear of the pain coming back. And as a gift for you who stayed until now, I'm leaving a quick exercise routine for you to do before bed to release all that tension, all that stress built up during the day, improve the quality of your sleep, and help you wake up without pain. Just click here on the screen to watch. And if I managed to help you today in this video, send this video to someone who has lower back pain, who has some kind of spine problem. That's all I ask of you. Make sure this video reaches those who need it. I'll stop here. Big hug and see you next time. So